Good afternoon. Welcome to NIDI Grand Rounds. Today we have Dr. Junkins presenting. Dr. Junkins, I'm going to start sharing my screen and it's all you.
Okay, thank you much. Let me get this going here. Oh.
I'm still, let's see, I'm having technical difficulty. Okay, here we go. Share. All right, there we go.
All right, let me try now. Go. There we go. Screen to share and we got it?
Yes.
All right. Today I'm going to talk about, one of my favorite topics, a cool thing that's happened to us, and it's happened to most laboratories now, most of the larger laboratories, but there's still a lot of labs that haven't come into this. You know what we do in micro? We grow bugs up and then we have to go about and identify them. We have to they're growing on a plate. We have to figure out what species it is. So let me tell you how this has changed over the years. This is the really old days. Believe it or not, this is even kind of before my time. We would have all these tubes with different media in it, looking at different biochemical reactions. But, all of these things, does the bug utilize citrate as a carbon source? Does it ferment mannitol? All these different tests that we could tell from the color of these tubes. And you're trying to identify the bug, and you'd have, sometimes 5, sometimes 15, sometimes 20 tubes lined up for that one organism. And we would go about, and you can tell from the cotton plugs in these ones that these are actually made in the laboratory, not purchased. So it took a lot. But it was using biochemical analysis to look at what biochemical properties of that organism there were. Things got a little bit better in the old days. What we did is we miniaturized it. So this is all the exact same tests. Here's your citrate utilization. Here's your mannitol fermentation over here. So you've got all the same tests that are going on. It's just we made it smaller so we can get a whole lot more in one space. It was a lot easier to work with than having to make up all those tubes. Then we get to the not so old days. In fact, the days that are still going on right now, we not only have these miniaturized, but we have it automated. So these cards, this is a Vitek card over here on the right. This is a microscan panel down here on the left. And you can see in all the little purple lines here, these are all the exact same biochemical tests that we've used for 100 years. They're just being small, and we can put it in this machine. The machine will incubate it, and the machine will read it, and the machine will analyze it. So we don't have to think about it as much as we used to have to do. But it's the same mechanism of identifying microorganisms that we've used for really very close to 100 years. Then about 10 years ago, there's a complete change, a complete revolution, a completely new way of doing it. Looking at the molecular weight of the proteins that are present in that organism. And that was this system right here called MALDI, MALDI-TOF. I'll go ahead and say it. It stands for matrix absorption. Oh gosh, I can't believe I'm losing it here. Matrix absorption. I forgot. Anyway, it's mass spec. Matrix assisted laser desorption ionization time of flight mass spectrometry. There you go. It's mass spec, which we never thought we would use. These are the two most common ones that are out there. This make up probably 99% of the market. The Vitek MS, and then the Bruker Biotyper, which is the one that we have. So this is completely different. And I'll tell you, when I first saw this, I said, this will never work. These people are crazy. This is never going to do any good. We still have to grow bug on the plate. So once we get a culture growing, we get this colony growing. You can see this heavy growth of something here. We want to find out what this is. We just stick a toothpick in that colony and smear a little bit on this tray. This is called our target. It's got 96. This particular one's got 96 little circles there. And we smear the bug inside that little circle. You got to get it just right so you have the right amount, but it's not too difficult to do. Then we put this stuff on. We just call this matrix, or HCCA. If you're interested, it's actually alpha-cyano-4-hydroxycinnamic acid. Okay, 1 microliter onto each one of those little circles. Let that dry. And what that does is it makes everything positively charged. It coats all the proteins and makes them positively charged. And then it goes inside our instrument right here. Now, what's inside is a laser. And that laser is going to shoot up this little circle right here. And it's really pretty cool when you're watching it because it does like 40 shots in about half a second. And then it keeps doing that until it's got a good reading here. But you can see it blows the cell apart. Here are all these proteins, different size, different shape proteins. And as they move up within milliseconds, as they move up this tube, it separates them out based upon molecular weight. The smaller ones are going to go faster, the bigger ones are going to go slower. And up at the top of that instrument, there is a detector that will give you a graph that looks just like this. So here's the really small proteins, and here's the larger proteins. So you got the molecular weight, you got the relative quantities. The software kind of converts that into something that's a little more easy to analyze. And then it spits out a report. So this is one of our reports from just the other day. This is what it looks like. On this particular instrument, this is the Bruker instrument. What we're looking for is a score of 2 or higher. Okay, that's a good identification that's 2 or higher. So you can look at this one right here. Sometimes it doesn't work. Gave us a score, but it's going to say it's not a good enough score. There's no identification there. But a Corynebacterium pseudodiphthyricum, excellent score. Canada's, Klebsiella, all these different bugs here has given us good scores at. You may notice this one here. If this were in color, which my printer wasn't, this would be red. These would all be green because they're greater than 2. This one is yellow. Anything between 1.7 and 1.99 is considered good identification to the genus level, but not the species level. I really don't care in this case, because once we get this, we have to decide how we're going to report it, what it's going to look like. I really don't care about this. We don't report these bugs to the species level or to the group level. I'm going to call this a Viridans strep anyway. So as far as I'm concerned, 1.97 is good enough for me to call this a Viridans strep. This parasanguinus right here is a high score, but we're still going to call that a Viridans strep. We don't bother trying to separate those different species of Viridans strep out. But that's what it's going to look like. We're going to get this nice report. We can put up to 96 different bugs on this one run, and it's going to zap them all. And you can see sometimes we repeat. This is the same one that was repeated. We do that sometimes if we don't feel very confident about the amount of bug that we put on the circle at that point. But this all comes out. Now, there's a few cool things about this. Let me kind of go through kind of the nifty stuff. How has MALDI changed microbes? Obviously, this was a huge revolution in how we went about identifying organisms. And it works, all I can say is it works fantastic. It's our favorite toy. One thing, faster identification. It is really quick. I've got a bug growing on a plate, and I do still have to have a colony on the plate. For the most part, I cannot do it directly from a patient specimen. I can't do it at all from a patient specimen. But once that target is on the instrument, it basically takes less than a minute per organism to get done, to have an identification. So if we fill up that entire 96 well tray, and we don't do that, we don't do 96 at a time. We'll do 20 at a time and then be able to use that tray to do more later so we can get them done faster. But that entire 96 well tray, 96 organisms can be identified in probably about 45 minutes or so. So it's super fast compared to the biochemical testing, which pretty much always was going to require overnight incubation. So if I've got a bug today, it's Wednesday, it's on a plate, I can have identification by MALDI in 30 minutes. If I were going to set up a biochemical panel, you're not going to get it till tomorrow. What that also does is the identifications come before the susceptibility testing. When we did biochemical testing, we would set up a panel that would do both biochemical testing and susceptibility testing. And so if I had today, I said I gram-negative rod. Tomorrow, the final report would read Klebsiella pneumo, and here's the drug resistances. Here's the susceptibility results. You'd get the identification and the susceptibility at the same time. With MALDI, what we do is we can tell you right now that it's club pneumo, and you'll get the susceptibilities tomorrow. In my mind, what that does is it makes the antibiogram suddenly much, much more important, because now we can go to the antibiogram and say, look, this is club pneumo. We know this is club pneumo. Here's the drug resistance, drug susceptibility pattern that we tend to see with club pneumo. Honestly, I always thought antibiograms were, a little weird, a little dumb, because not many times would you walk into a doctor's office and the doctor would say, I think you have a Citrobacter fruendii infection. This urine looks like Citrobacter fruendii. But now that antibiogram becomes important, because we can say, look, you do have Citrobacter fruendii, or you do have club pneumo, or you do have staph hemolyticus. Here's what our resistance pattern looks like for those organisms. For some bugs, some fastidious slow-growing bugs, as soon as we got a colony, we can do that identification. Some of these bugs, the biochemical test didn't work very well, and it would take us a week or more to get an identification done. Now, bam, it's done quickly. It's also simpler for us. It's not just nice for you guys. It's simpler for us too, because we have this one thing that can identify all these different kinds of bacteria, fastidious organisms, anaerobes, yeast, all of these at one time. When we get a culture, we would have to actually usually gram stain the bug off the plate first to figure out what kind of bug it was, so we know which biochemical panel to use. Do I use the panel that works for yeast, or do I use the panel that works for gram-negative rods, or the panel that works for fastidious organisms? Now we don't need to do that. Now we just don't even gram stain. We see a colony on a plate. We think it looks like it might be important. You put it on MALDI, and you're done. Other thing, believe it or not, it's cheaper than biochemical testing. Now, okay, true. When I say it's cheaper, that means now that we have the machine, it's cheaper. The machine itself is going to cost you $200,000 to $300,000. But once you've got it, the actual cost of performing identification is very low. So it used to be that we would have to look at plates and say, which bugs on here do we think may be clinically significant? And I'm only going to do identification on the one bug that we think is clinically significant. Now we look at a plate and we can say, well, it could be this one, or this one. I don't know if it's clinically significant or not until I get the identification. So we have a very low threshold now of doing susceptibility testing. We have any interest in this organism at all, in this colony, we can do identification and find out what it is, and then use that information afterwards to decide what's clinically significant and what's not. So not only are we getting more accurate identifications, but the overall culture result, the overall interpretation of the clinical significance is going to be more accurate as well. It's also cheaper in just this regard too. You don't have to buy all those biochemical tests. You have this one machine and the one set of reagents that goes with it. You do not need to have on hand 10 different biochemical tests or panels of biochemical tests. So ordering is simpler, inventory is simpler. We don't have to have the space for all that other stuff. And it is going to save money in that regard. Downside of it, MALDI, it's a machine. Every now and then it goes down. And a couple of times a year, they have to come do preventive maintenance, which takes it down for a day and a half. We don't know what to do. We've forgotten the old way of doing things. We can't keep all that biochemical stuff on hand just for those instances. So we do have to kind of work around on those days. Going without the instrument is difficult. We're hoping to get a second one. It's been on our wish list for a couple of years now. So if anybody wants to call Norton administration and tell them that we absolutely have to have a second MALDI, then please feel free. Okay, I'm joking. You don't need to do that. But, I wouldn't argue. Here's the other thing. it's got a much larger database of organisms. And you look at our microscan instrument that does the biochemical testing, and okay, there's a couple of hundred bugs in that. If you look at one of those API strips, there's 200 or 300 bugs that are in that database. Obviously, if a bug's not in the database, the panel's not going to be able to identify it. It doesn't know it exists. You look at MALDI, and you're talking about a few thousand different species that are in the MALDI database. Not just clinically significant ones, but also some that are significant in veterinary medicine, some that are significant in environmental microbiology. So there's a much, much larger database. So it gives us the opportunity now to identify bugs that we were never able to identify before. Ones that we would just kind of blow off and say, we're going to call this Corynebacterium species, or we're just going to call this, a strep species or something. Now we can figure out exactly what it is. Even some things like lactobacillus, which always was just kind of like a shot in the dark, looks like it might be a lactobacillus. We're gonna call it a lactobacillus. Now we know exactly what species of lactobacillus it is. Now this does include a lot of bugs that we've never even heard of. It's kind of gotten me in trouble a little bit with some of our infectious disease doctors who call me up and say, you can't do this. You can't just name this bug. Because they walk into a patient's room and the patient says, oh, look, I've got blah, 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 blah. Or the hospitalist or something says, I've got this particular weird bug here. And the infectious disease doctor does the exact same thing that the rest of us do, which is go to Google or go to PubMed and try to figure out what this bug actually means. The other thing that it helps us a lot is we used to send out a lot of bugs that we could not identify at all, but we thought might be clinically significant. It had to go to a reference laboratory where initially they were getting DNA sequencing done, which cost $100 or more. And then eventually they were getting MALDI done, which didn't cost as much, but why send it to a reference laboratory to do MALDI when I can do MALDI in-house? We don't send bugs out for identification much anymore. Very, very rarely do we have to do that. Now, let me give you some examples of where this could be an issue. What do all these bugs have in common? Don't stress too much about this because I'm going to tell you what they all have in common. These are all bugs that we identified in our laboratory fairly early when we started MALDI that we were never able to identify before. We had no biochemical method of identifying these organisms right here. I can make another table 3 or 4 times the size of other organisms that are in the same boat. So our first problem when we identify these guys by MALDI is it worth reporting? Is it clinically significant or not? We only want to report the bugs that we think are clinically significant and need to be treated, or the physician needs to know about. But there's a problem with that. There's not much information about some of these organisms. The reason is, until recently, nobody else could identify these bugs either. You may have had a few, academic labs that had a sequencing ability to identify these bugs, but generally speaking, hospital laboratories were not able to identify any of these bugs by biochemical means. And the problem with that is that you can turn to the literature, but you're not going to find much about these organisms, or you're going to find them in there, but called something else because they just got identified as Corynebacterium species or something. So it's kind of hard to find much information about some of these organisms. When you do find information, you kind of run into another problem with some of these. And this is not something I'm fussing about MALDI here, but something I'm fussing about the literature in general. You get a lot of non-specific case reports. A bug was associated with something or it was isolated for something. For example, here's a bug that we get fairly frequently now. Never got it before, but we get it fairly frequently now. Adipovium parvulum. This is what you find. Some are associated with dental infections such as endodontic abscess and periodontitis. Other studies have suggested a beneficial role. So when we get it from certain specimens types, what do we do? Are we thinking that it's significant, or do we think it's normal oral flora? This is a good one here because this bug here, this Turricella otitidis, in the old days, we would have called that Corynebacterium species, and we would have blown it off and said this is normal skin flora. We get this bug at least on a weekly basis now. It's a common organism, almost always from ear specimens, usually isolated with another pathogenic organisms associated with acute and chronic otitis media, but its pathogenesis has not been established. So here's somebody who has apparently some sort of ear infection, and we isolate this bug. Is it the bug that's causing the ear infection, or is it a skin organism that is just normal flora on the skin around the ear? And therefore, we kind of expected it to be there anyway. Hard to come up with some of those issues. Let me give you a couple more examples. Corynebacterium croppenstedtii. That was one of the first ones that we got when we went to MALDI and said, what the heck is that? Never would have been. It would have been called the Corynebacterium species. But this is a common cause of chronic and very difficult to treat breast abscesses. So it really is important to know when you get that from a breast abscess. And every time we get this organism, every time it's from a breast abscess, it doesn't do anything else. Neisseria weaveri is one we've actually talked in here before. No way could we identify that before, but now we know it's a pretty common cause of dog bite infections. Easy to treat. It's not going to, you use your amoxicillin, it's going to kill it, but still kind of cool to know. So when you look in the literature, here's the next problem, is you see all kinds of things like this. These are all bugs that we've identified in our laboratory, most of them more than once. Actinium shali is very common. And some of the stuff that's in the literature about them, this one here is really cool, the Pseudoxanthomonas cauchingogensis. The only paper out there is that it was isolated from an oil-polluted site in Taiwan. We've gotten it twice from patients. It's kind of hard to figure out the clinical significance. The other problem with the literature is that these case studies that are available report a numerator. They tell you about a particular cool study, okay, one case, but they don't give you a denominator. How many times was this organism isolated from a patient and it really was doing nothing? It was normal flora, it was transient flora, it was environmental contamination, whatever. You don't get that. You don't see papers that are written like this one, Weirtobacter kentuckiensis isolated from a toe. It wasn't important. Okay, so I don't know. When we isolate a Weirtobacter kentuckiensis, I don't know. I've got one report in the literature that says it was isolated from a case of pneumonia. I'm making that up, but I don't know how many times it was isolated from patient specimens that was completely meaningless. So how do you handle these? Let's look at this one here. Single blood culture positive for one of these bugs right here. Those of you in infection prevention, you look at this and say, okay, is this going to count as a CLABSI or not if you've got one of these? If you have a laboratory that does not have MALDI, then this is how they're probably going to be identified. Corynebacterium species, viridans strep, or bacillus. So you look at those and say, those are basically contaminants until proven otherwise, especially Corynebacterium and bacillus. So yeah, if this were called a Corynebacterium in a laboratory that did not use MALDI, called it Corynebacterium, you'd say that's a normal skin flora bug, that's contamination. What about now that we have MALDI when we call it Pseudoglutamicibacter comensii? Is that still considered a common skin flora organism? And is it still going to be considered a contaminant and therefore not a CLABSI? Made it a lot trickier to do that kind of thing. Now, while we're here, let me talk about some of the downsides. I already kind of mentioned one of the downsides, and that's too much information. How do we interpret these cultures with organisms we've never heard of before, we've never been able to identify before? There's not much information available on them and their clinical significance. So there's a whole lot that needs to be done to look at these. There's only been a couple people who've really tried to do it since MALDI started, and I think really not too successfully. But we need to get a lot more experience being able to identify these organisms and tell whether they are commonly clinically significant or common normal flora or somewhere a mix between the two. And this is my little gripe about MALDI, both of the manufacturers. There are some important organisms that aren't in the MALDI database. We haven't talked about bioterrorism agents, select agents, but hospital laboratories that are the first level in the laboratory response network for these bioterrorism agents. Most of our hospital laboratories, we're not allowed to rule those in. If we suspect somebody's got brucella and we can't rule out brucella, then we have to send it to the state laboratory and they will do the final identification of it. But because of that, the manufacturers, both the Bruker and the bMARIU, have left those organisms out of the database. They're not in there. Here are some examples right here. So for example, we had a brucella last year, I guess it was the year before now, maybe. We handle it like we do everybody. It's on the plate. We put it on MALDI. MALDI doesn't give an identification. And so we keep working with it. If MALDI identified it, or if MALDI would say something like, hey, this might be a bioterrorism organism, pack it up, seal it up all nice and tight, send it to the state laboratory, then we'd know what to do with it. But these bugs are not in, including Vibrio cholera, which is not a select agent, but they still chose not to put it in there. We had a case of cholera just last year that luckily, MALDI identified as Vibrio mimicus, and a really sharp, intelligent micro lab director, said, okay, let's test that a little further, and it was cholera. I'm worried about Francisella, to be honest with you, because before we got MALDI, we would always have a Francisella or two every single year. We've had MALDI now for going on 8 years, and have never had a case of Francisella in that time. So I'm kind of worried that we may be putting Francisella isolates on the MALDI and getting the wrong identification. So we might be missing some of those. Anyway, I kind of feel like this increases the chance of lab exposures and puts our employees at greater risk for infection with those. So if you're in a facility that does not have MALDI now, how can you justify it? It's an expensive instrument to bring on. We could look at hard dollars. These are things where you can actually demonstrate where you're going to save money. You are going to save money on biochemical tests. You are going to save money on sending organisms out to be identified. You might save a little money on labor costs because it's faster and easier to set up a target to run on MALDI than it is to set up a bunch of biochemical tests. So you can quantitate those and give them to your administration and say, this is where we're going to save money. You won't be able to save the entire cost of the instrument within a year or so, but you'll have a return on investment that you can calculate there. Then there's also soft dollars. These are things that you're not going to be able to quantitate very well. Obviously, we're getting a faster identification. We're getting a more accurate identification. So what does that correlate to with regards to reduced length of stay, reduced pharmacy expenses, not having to have, broad spectrum reagents when you could have narrowed down much earlier, and other testing. Find out what this bug is and not have to go pay for other laboratory testing to be done. Those are all things that are very, very difficult to quantitate. No one really argues that MALDI is not going to reduce your expenses in all these areas. It's just really hard to quantitate how much it is. So that's the difficult part. I know one facility that got, I'll tell you, the 2 facilities in the state of Kentucky that got MALDI first. We were not one of them. We were number 3. The first one is actually a very small laboratory that was able to get it, presumably because the CEO thought it was cool. The other one was a large laboratory, and I talked to their laboratory directors, and she said she went into administration and said, reduce length of stay, and they wrote her a check. It didn't work here. I said, reduce length of stay, and they said, yeah, okay. So how much does all this contribute to saving patient lives, better outcomes? You want to include that as well. So is it worth getting? Those of you who don't have MALDI yet, is it worth getting? No question. Absolutely, it is worth it. Moderate to large laboratories, this is the standard now. If you're not using MALDI, you are behind the times, and you need to get it now. Small laboratories, it's going to be a little bit harder. The return on investment is going to take a bit longer to get that return on investment back. Honestly, what I would suggest is you do what I did. You put it on the wish list, you put it on the list every year of equipment that you want to buy, and you constantly harp about it until administration. And sooner or later, they'll cave on it. So it is the way to go. It is the way that we need to be doing not susceptibility, identification now. It will lead to some issues, obviously, growing pains, but still the benefits are going to be much greater than the old-fashioned way of doing things. That's all I've got for you. Be happy to handle any questions if somebody has any.
Hey, Alan, it's Sarah. I think we've talked about this a little while ago, but I wanted to ask you again about any possibility that we're considering like direct from blood MALDI testing in the future.
I am definitely thinking about it. Okay, for those of you who don't know, there is a way to do it direct from blood cultures, not from blood. You got to let the bottle grow on the machine and get a positive blood culture. And then what you can do is you can take that blood, you can spin it down, you can wash the pellet a bit, you can extract the pellet. It really doesn't take long. It takes probably about 10 or 15 minutes. And then put that pellet on MALDI and get an identification directly from that positive blood culture bottle. For us, in our hands, it works maybe 75% of the time. It does sometimes it doesn't work. Kind of depends on the organism. I like it. I think it is so much fun to do, and it is so cool to do. So yes, I would like to do it. The problem for us is getting it to fit into the workflow. As you know, blood cultures are going to come off that machine positive around the clock, all the time, all shifts, doesn't matter. And to be able to get somebody to say, I'm going to stop what I'm doing right now to do this extraction, and then get the machine going. You know, if you don't run your machine around the clock, you know, to rev it up to say, I'm going to do this one bug, causes some workflow issues. So that's really where we're getting. When we get to the point where we can have plate readers around the clock, then we may be able to look at it a little more. The other thing about it is that this is not currently going to give you any susceptibility data. They're working on it, trying to get it to where it can differentiate MSSA from MRSA, things like that. You know, conceivably at some point, it's going to be able to tell that there's, you know, there's a carbapenemase there. It can actually do those things now, but only in a kind of a research status, not in a way that you would actually impose onto a clinical laboratory to do. So doing things like the Verigene or the BioFire or these rapid molecular stuff, that's going to give you a result for the targets that it has on that panel. It's going to give you a result almost as fast as doing direct MALDI on the blood culture. And it will give you those important resistance genes as well. So yeah, I would love to be able to do it. And I do play with it sometimes. You know, if you guys call me up and say, here's this gram-negative rod that was in a blood culture and MALDI didn't come up with anything. Verigene was completely negative. Sure, if I'm sitting here, I'll say, I'll go play with it. I'll go put it on MALDI and see what it does. We don't do it officially. We don't report it because we have not validated that in our laboratory, but it is super cool. It is super cool.
Okay, that is a cool trick for me to know.
Yeah,
you're gonna get a call from me at some
I'm
point.
gonna get all kinds of calls now, aren't I?
All right, thanks, Alan.
You bet.
Hey, Alan, I have a question. Can you talk a little bit more about what you were saying with the bioterrorism agents and how the lab has certain rules that they can't identify them? What does that process look like again?
Yeah, you know, the rule for it, we have these nice notebooks from the CDC that tell you this is what all these bioterrorism agents are going to look like. This is what they should look like on a plate. This is what they should look like on a gram stain. here are some rapid spot tests, rapid biochemical tests that you can do on them. And then you get to a point where you say, well, I think, this could be a Brucella. Okay, I can't rule out Brucella. And so what we have to do is we have to, at that point, it's packed up, it's nice and tight. We're doing everything in a safety cabinet, the plates are sealed, it gets sent to the state lab. And so the state lab is the next level up when it comes to the LRN, the Laboratory Response Network, where they're going to be the ones who rule in. They're going to be the ones who say, this is Brucella. We can't. All we can really do is we say, I can't rule out Brucella. And so I'm sending to the state lab. That's the rule nationwide about how you're supposed to handle these potential bioterrorism agents. And because of that, the Bruker MALDI that we do is a German company. It's the German government that made the rules here. The BMRU is a French company. It's the French government that made the rules here. But they said, if you don't have a license to handle these organisms, and we do not have a license to handle the select agents, then you cannot be identifying them. And since you cannot identify them, we're not putting them in the database. So, that's fine, that's great, but like I said, it leads to these problems where our standard thing of doing right now with every culture that we work up is we look at the colonies on the plate, we go from there to MALDI, and so every time when we've had a Brucella, I'm worried now about Burkholderia pseudomallii. Now that it is supposedly endemic in the southern United States, we might start seeing that. And I'm just hoping that when it shows up, supposedly it smells so much like dirt that everyone will kind of have an idea ahead of time. I know you're not sniffing these things, but apparently, this bug is so bad that when you open the incubator and smell a bunch of dirt, there's might be a plate in there with pseudomallii. I don't know. Somebody who's got more experience with that bug can tell you. So I'm just worried. We've seen it with our Brucella, where there's when our last Brucella case showed up, I think there were 3 techs who directly worked with it on the open bench, and anybody who's in the room is considered exposed to that bug. So there was probably 15 to 20 people who were exposed to it. So it just seems to me it would be much easier to put those in the database and say, cannot rule out Brucella, send this to the state lab.
Yeah, that's really interesting. I didn't know that piece of workflow. So thank you.
Yep.
Looks like there's a question in the chat.
Yeah, I saw that about Carius. Oh, Carius. Yeah, one of these days we need to talk about Carius. And Carius, Carius is fun, interesting, useful for its purpose, which is to detect cell-free DNA in the bloodstream. The idea with Carius is that there's an invasive infection someplace in the body. You may or may not know where that is, but there's an invasive infection somewhere. And because of that, DNA from that invading organism will leak into the bloodstream, will get into the bloodstream, and you'll be able to detect. If I've got, obviously, if I've got endocarditis, I would expect DNA from the infecting organism in the bloodstream. But if I had, a liver abscess, then DNA from that infecting organism would get into my bloodstream, and you'd be able to detect the DNA there. So it's not a cultural method at all. You're not even detecting organism. You're detecting cell-free DNA. So it's really kind of the opposite way of looking at it from MALDI would be, where we have to have an organism for it to work. You're actually looking at the protein, not the nucleic acid. So Carius would be good in situations where you really can't sample the active site of infection, where you may not know exactly where that site of infection is, or would be too invasive to get there. You have somebody who's not a candidate for surgery, or surgery is just not going to be able to reach these spots. that's where Carius comes in and would be of the best use. The problem with culture is that we still have to be able to sample the site of infection. You know, if it's a liver abscess, you need to get in there and sample the liver, and then you have to have not treated the bug so that he's still alive and will still grow. Carius doesn't have either one of those restrictions. Okay.
Okay, great.
Thank you
Well,
very much.
thank you. Yeah, thank you so much. And also just wanted to make everybody aware that there has been a change in the schedule for ground rounds. And so our next ground round is going to be on January 31st. And I will see everybody then.